Hi friends, I am Dr. Priyankur Roy, infertility specialist and gynae endoscopic surgeon based at Siliguri in West Bengal. Today I am here with you people to talk about breastfeeding. As you all know, breastfeeding is a very important entity for a child as well as for the mother. Exclusive breastfeeding means 100% breast milk, no solid food, no liquid food, no water, nothing but only breastfeeding. And exclusive breastfeeding has got a lot of advantages which is delivered to the mother, to the baby, as well as to the environment. So let us look at a few advantages of breastfeeding. One is it saves life and protects the baby against diseases and many bacterial infections and other infections. Second is it provides all the nutrients that the baby needs for the first 6 months. Remember, all the nutrients. So some of you ask whether we should give some other supplements, whether we should give some protein, some DHA, something else, but believe me, nothing else is required other than exclusive breastfeeding. Number three, it ensures clean and safe source of milk. You all know that hygiene is very important for a baby to prevent infections like diarrhea, etc. So exclusive breastfeeding from a clean source after obviously the nipple is cleaned is very safe for the baby. Number four, it makes the child grow strong as well as intelligent because it has all the nutrients and everything that is required for the baby to grow strong. Number five, it breaks the cycle of diarrhea and malnutrition because for diarrhea or for any other disease like asthma, etc., immunoglobulins, etc., which is present in the breast milk is very important for the baby. Number six, creates a very strong bond between the mother and the child. The bond that is to life for lifelong, to last for lifelong, is developed right when breastfeeding is done correctly for initial 6 months at least. Number seven, it reduces the mother's risk for ovarian and breast cancer, a very important factor. When ovarian and breast cancer can be decreased or can be reduced to a very large extent when breastfeeding exclusively is done for the first 6 months. It helps space pregnancies, that is called lactational amenorrhea method. That is, when the breastfeeding is done exclusively, ovulation is delayed, and when ovulation is delayed, thus pregnancy can also be delayed. It saves money, of course, because packaged food costs a lot, and when you do exclusive breastfeeding, there is no need of buying packaged food, and thus saves money. Number 10, it protects the environment because packaged food comes in a package and that after being used is thrown into the environment and it causes environmental pollution. So that also can be prevented. So when you see so many advantages of breastfeeding are there, so I believe that you will go ahead only with breastfeeding and not try any other formula feeds. Once breastfeeding is over, then you can directly go into weaning methods like feeding the baby other foods, which of course your pediatrician will be able to guide you better with. So friends, even in today's day, when a patient is seropositive or can pass on any infection to the baby and also is not economically that stable, we do prescribe them with breastfeeding because that sends the immunoglobulins to the baby and improves the chances of the baby's survival and also it being healthy in future. Thank you so much for the patient hearing, and I wish all of you a very safe COVID-free period. Thank you.